The difference in news and information. This is today's THV This Morning.
Age 40, that is when eye doctors suggest adults should start having their eyes screened. Early symptoms of eye disease and vision changes typically start showing up, and from the initial screening, your eye care physician can chart a course for follow-up exams. We have Dr. Dan Hennessey with Little Rock Eye Clinic here with more. Doctor, good morning to you.
Good morning.
Thank you for being here. I first want to start with, okay, age 40, is that the typical time that most adults start seeing the shift in their vision here?
Exactly. 40 is roughly the time that our eyes begin to show signs of aging. We undergo some visual changes. And I'll give you an example of an email I received from a friend just last week. He wrote, basically, I turned 43 last month. I still see great at distance, but now my near vision's really poor. My wife says I should just go buy some over-the-counter reading glasses. What do you suggest? And my answer to him is that while the over-the-counter reading glasses probably is all he needs from a visual standpoint, that change in vision is a good indicator that it's time to start getting regular eye exams. If you're fortunate enough to get to the age of 40 without needing glasses or contact lenses or being treated for some type of eye disease, then roughly around the age of 40, whether you have symptoms or not, whether you have risk factors or not, that's a really good time to see your optometrist or ophthalmologist for a baseline eye exam. And the doctor will then set up an appropriate recall time.
So that's your number one, establish the baseline and get in to see the doctor. Also, early diagnosis, early treatment here, because that really can be beneficial when you're starting to see symptoms early on.
That's very true, and particularly if you have a personal history of diabetes or hypertension, some other systemic disease, or if you have a family history of glaucoma or macular degeneration, that's the time that you want to get in. The earlier the exam, the earlier the treatment, the better the outcome. And besides the eye problems that I've already mentioned, there's things like ocular surface disease, dry eye, computer vision syndrome that are all much more common after the age of 40.
Give us a percentage of adults that you're seeing that come into your office that need glasses, need contacts, need some type of help from you.
Well, the vast majority.
Vast majority.
Vast majority. That's why they come. And really that's kind of why I'm here this morning is to point out the fact that even if they don't really need glasses, other than maybe some reading glasses, they still need to be getting in, having their eyes examined and establishing that baseline for their eye health.
Because the earlier you can get in is the better. Dr. Dan Hennessey, thank you so much for your time this morning.
My pleasure.
We really appreciate it.